Well, aches and pains, they become more common as you age, so common that you tend to go, I must have just slept funny, and you write them off. But there are 6 symptoms that tend to show signs of a deeper issue, and you should not ignore them. I love this topic here. Dr. Kevin Stevens joining me now to explain a bit more about these symptoms. Good morning, sir.
Good morning. Good morning. How are you this morning?
Good, and Brandon and I were just saying we are those people who are like, I don't know,
Write
it off. Ignore, I'll
right,
just stretch,
right.
drink some water,
Yeah.
But they're saying there are some symptoms that you really should not ignore.
Yeah, absolutely. The first thing is a headache, chest pain, a sudden headache, a weakness. And sometimes you say, well, I slept funny, I just feel a little tired.
Didn't drink enough water.
Right, those kind of things. But if you have a sudden headache, chest pain, shortness of breath, that is a big thing, because the thing is, when you have something like a stroke, if you get to the hospital within 4 hours, they can use drugs to actually dissolve the clot, and you can get a better return of your normal functioning. But if you wait too late, the clot forms and then you get death of tissue, and there's very little you can do. So if you have chest pain, shortness of breath, dizziness, weakness, you stumble, you fall, you have loss of gait or something, that could be a bigger problem going on.
Okay, that's a serious one for sure. Okay, what about if you're feeling some tenderness in the back of one of your
the thing
legs?
is, in your legs, more particularly if it's unilateral, that could be a blood clot in your legs. Some people get swelling in their lower legs, but it's both legs. And that could be something like heart failure, congestive heart failure. You get fluid in both legs. But if it's one leg and it's swollen, red, and tender, there could be a blood clot in that leg. The problem is the clot can move. So if you have a clot there, it can go on up and go on your, actually can get to your heart and lungs, that kind of thing. The deep veins, thrombosis is what we call it, when the clot goes from your lower legs all the way up to your lungs, and that could be a big problem also.
Yeah, I want to get that checked out for sure.
Absolutely. The next thing is blood anywhere, actually. If you cough up blood, if you sneeze blood, if you blow blood out your nose, if you have blood in your stool, blood in your, if you see blood anywhere. No, blood in your urine, all those things could be a big problem. Blood in your urine could be a kidney stone. It actually could be a bladder tumor, all kinds of things going on with that. Blood, when you're throwing up, you have veins inside your stomach and in your esophagus, and if one of those things ruptures, then you can throw up blood. And then the problem is you don't have a lot of time. When you start seeing bright red blood, then you got to really get going, because you could lose a lot of blood in a very small period of time. It could be a very big problem for you. So if you see, even if you're sneezing, coughing up blood, that could be a sign of like lung cancer.
That would be one I didn't ignore. I can safely tell you, that's one I wouldn't have ignored.
Nosebleeds. Many times you get nosebleeds and you wonder, well, no, check it out, because it could be a whole bunch of things going on in your nose too. So, sometimes you can have nosebleed. That's just the thing, but
just a nosebleed. But sometimes maybe it's worth more.
It could be a
so just be cautious. Get that nosebleed checked out. Okay, what about wheezing or shortness of breath?
Now, asthma is a big problem, particularly in the South. Particularly now we have pollen in the air, and as you get an asthma attack, your airways constrict, and then you can get short of breath, and it'd be hard to breathe, and that could be a really big problem. You can become hypoxic, you can pass out, you can faint, particularly if you're driving or something, operating heavy machinery. Now the good news is there are medications that can help open up your airways so you can breathe a whole lot better, but you got to go to get it. I mean, you just can't let down your window in the car and expect that to go away. It doesn't work that way, So
that's definitely a good one. And then finally, we're out of time, but I know we want to mention suicidal thoughts.
Mental health is a big problem. Suicide prevention, the thoughts of hurting or harming yourself and that kind of stuff, and then particularly even in kids. So we have to listen more and act upon it. Don't just take it and say, it's the blues or something like that. And you can dial 988 and you can get mental health services and that kind of thing. But that's a big problem in terms of suicide prevention, particularly now with all the stress, the war, the news, the media.
And we have that number up there on the screen as well for anyone who might need it. So thank you for these. We appreciate you.